Hi, I'm Stuart Gordon of SMG Safety, and today I'm going to talk you through how we operate the ZOLL AED Plus Defib. I've been asked by a number of football clubs and community groups if there was a video that we could share with the wider community on how this is used. So today we're going to go through the ZOLL AED Plus. The ZOLL AED Plus is the British Heart Foundation first choice of defib, and in terms of maintenance, there is very little maintenance required other than checking that it is operational ready. To do that, we are looking in the top corner. There is a green tick. This tells me that the machine has done its 28 daily checks on its system to ensure that the batteries are good and the pad's good and the connections are all fine. If it's not happy with itself, it will turn to a red cross, and the red cross will indicate that you need to switch on the power button, and it will explain what is wrong with it. From there, if there is any issues with it, if you just give us a call, we'll come out and we'll have a look at it for you and make sure we can get it back operational ready for yourself. Your ZOLL AED Plus comes in a nice carry case, which we just unzip. The defib is designed to talk us through step by step what we need to do. To open the defib, we lift it open. I've seen people trying to open the handle here. All we do, lift it open, you get your fingers underneath, and inside you will find the pads already attached to the machine. We'll come back to the pads in a little moment. So around the defib, we have a step-by-step guide telling us how we should operate the defib and what we need to do. Now obviously, if you're trained, the most important thing is to get the pads open and get them onto the chest as quickly as we can. When we've switched the power on, you will see that it will jump straight to analysing. These are designed, as we say, we've got these in the community. These are designed if somebody is not trained at all, then we can talk through, the machine will talk you through step by step what we need to do. So I'm going to switch the machine on as if we've had no training, and let's see the steps that it takes.
Unit OK, adult pads. Stay calm. Check responsiveness. Call for help. Open airway. Check breathing. Attach defib pads to patient's bare chest.
So the machine will go no further until we place the pads onto the bare chest of the casualty, and from there it will then jump to analysing rhythm. Things to look at on the screen, we've got a timer.
Attach defib pads to patient's bare chest.
In the top right hand corner, which will allow us to relay to the paramedic crew when they arrive to say that we've been at this for 10-15 minutes. It also records how many shocks we've delivered.
Attach defib pads to patient's bare chest.
During the CPR, we will also get a bar going up and down at this side here, and that will indicate whether we're pushing the 5 to 6 centimetres on the chest. If it is, it will say good compressions on here. If it's not,
attach defib pads to patient's bare chest.
Then it will say push harder. So there we have step by step. If we are trained, we want to just switch the machine on, open up the pads, get them on the chest, and it will jump straight to analysing. But this is a fantastic
defib pads to patient's bare chest.
A fantastic option where it goes through step by step when we've had somebody to use the defib with no training at all. So in the first few minutes of cardiac arrest, you can get what's called agonal breathing. And agonal breathing is your body taking its last breaths before it says goodnight. So we've done our primary survey. We have to be confident that they are either breathing or not breathing. Breathing normally is what we're doing just now. Good chest movements, good colour in the face. If they are not breathing normally, this is called agonal breathing, and we need to start what's called the chain of survival. The chain of survival has got 4 links to give this person the best chance of making it home. The first thing is we need to phone 999. Now, if we're on our own, we'll get that on 999 onto speakerphone and place it down beside us and talk through. We've got someone here who's collapsed. They are not responsive and they're not breathing. The next thing we're going to do is CPR, cardiopulmonary resuscitation, where we're going to get onto the chest, and we're going to expose the chest here, get the heel of the hand, centre of the chest, middle finger in line with the nipple line. We're going to get directly above, and we're going to start chest compressions. So we are pushing down on the chest, 5 to 6 centimetres on an adult. On a child over 1 year, it's 5 centimetres, and at a speed of 100 to 120 per minute. So that's 2 a second. If you like, you can sing Staying Alive at the same time. The next link in the chain of survival is early defibrillation. The stats are showing that if we can get the defib onto the patient within 3 minutes, we have a 74% chance of surviving this out of hospital cardiac arrest. For every minute that passes without defibrillation, we are then losing our chances by 10% per minute. So it's vitally important that we get the defib on as quickly as we can. So far, to recap, the chain of survival, early access is we're phoning for an ambulance as quickly as we can. We then start early CPR on the chest, delivering good quality chest compressions. And the next link we're going to talk through is early defibrillation. So the defibrillator, a lot of people think is going to restart the heart, but what it actually does is it stops the heart to hopefully reset it to go back into a normal rhythm. As we sit here just now, our hearts are beating between 60 and 90 beats per minute on an adult. When our heart goes into cardiac arrest, it can go into a number of different rhythms. So if we start off with VF, ventricular fibrillation, it's a chaotic state of the heart where it's no longer pumping the blood up to the brain or around the vital organs. So when we place the defib onto the person who's in VF, the machine will analyse this and say shock advised. When we hit the button, it's going to send 120 joules of energy in the first shock through the heart, bang, to stop it, for it hopefully to reset back into normal rhythm. The other one you can have is VT, ventricular tachycardia. It's again a chaotic state of the heart. Your heart rate will be up at 200, 280 off the planet. And again, we'll analyse this and it will say shock advised. Hit the button. This time, if it's a second shock from the ZOLL, it'll be 150 joules of energy. Bang, to stop the heart for again, hopefully to reset it back into normal rhythm. Now, the only other thing that the machine will say, it can either say shock or no shock. If it says no shock advised, it's for one of two reasons. Either our casualty is actually breathing and we haven't realised that, so it will not shock somebody who doesn't need shocked. The other reason it will say no shock advised is when the heart's in what's called asystole. Asystole is when the heart has got no electrical current left. So what we're going to do is, if it says no shock advised, we will then go back onto the chest and we will give good quality CPR until the next 2 minutes of analysis. We're looking at the patient to see if there's any changes in colour in the face, if the chest rising and falling, and being instructed.
No shock advised.
So no shock advised. I'm having a good look. Is there any change? No change at all. So I'm back onto the chest again. So again, 2 minutes of CPR, 30 chest compressions, followed by 2 rescue breaths through the face mask. I'm going to continue this to the final link in the chain of survival, which is when the ambulance arrives or somebody more medically qualified asks you to step back. If we did get someone back, then we would want you to keep the machine on, keep the pads in place, but monitor them and wait for the ambulance to arrive.